Hello friends, I am Zubair Ahmad. Welcome to my channel Learn and Live MD. A few of my friends have been asking me for psychiatry lectures, but because of busy schedules and different time zones, we couldn't find a time that worked for all of us. So I decided to record few psychiatry lectures and upload them here so they and all of you can benefit from them. So in psychiatry, we will be starting from the psychology portion. There are three portions: psychology, pathology, and pharmacology. In today's lecture, I will start from psychology and I will cover these conditioning things, classical and operant conditioning, and some ego defense mechanisms. So conditioning, we have two types of conditioning. One is classical conditioning, other is operant conditioning. Classical conditioning is basically there's an automatic response in which body learns some natural responses in response to any condition, right? So here the common example is like the involuntary response by the Pavlov's classical experiment with the dogs, and whenever they were giving force before that, they were he was ringing the bell, and which provoked the salivation. Even that dogs started salivating at just the bell, even without the food. So this is basically involuntary behavior, and your body reacts automatically to this. Next is operant conditioning. I'm going fast because these are less important. These are less tested in the exams, real exams. Operant conditions, these are basically the voluntary responses and depends upon rewards or the punishment. So usually we have three types like reinforcement, punishment, and extinction. Reinforcement and punishments are completely opposite to each other. Reinforcement means giving reward to something. Punishment like the punishment. Um, so here the reinforcement we have two types. Like one is adding the stimuli like positive reinforcement. Other is removing the something bad like this negative reinforcement. So in positive reinforcement, like we will add something good which increases the behavior. Like our target behavior is our will be our response, and like desired response is our positive reinforcement. So we will add in stimuli and it will increase the behavior. We will call it positive reinforcement. And if we remove a stimuli like a bad stimuli and it increases the behavior, that is negative reinforcement. So in positive reinforcement, I would like to give an example like if there's a child who is getting good grades, like someone is getting good marks in USMLE exams and we are praising them. So there's a positive like likelihood they will study more. That's an example of positive reinforcement. Or if someone is getting bonus at their job, so in that way they will reinforce showing up the job. There's the positive reinforcement. In negative reinforcement, we will likely remove something bad and it will increase the behavior, right? So there's a negative reinforcement. For example, whenever you will sit in the car, there will be alarm beeping, and because we haven't done this buckled up the seat belt, once you will buckle up the seat belt, the alarm will go away. Like by buckling up, alarm was going away. There's a type of negative reinforcement, right? So these are the two types of reinforcement. Okay, so in punishment we have also like the positive punishment and negative punishment. In positive punishment, we add an stimuli and it will decrease the behavior, and in the negative punishment we will remove an stimuli and it will decrease the behavior. There's a negative punishment. So let me give you an example. Like in positive punishment, we will add something which will decrease the behavior. For example, someone is coming late in the morning report, and we give them the extra shift, right? In that way, they will avoid coming late because they are getting the extra shifts. So there's the positive like punishment, right? We added something, we gave them the extra shift, and they will decrease their behavior. So they will come on time. Let me give you another example. Like if someone is gets, for example, there's a driver which gets a speeding ticket, which discourage future speeding. That's also a example of positive punishment. In negative punishment, we will remove a stimuli which will decrease behavior. For example, there is a student, he or she doesn't clean her room because they are using most of the time their phone and watching the reels and videos, so they don't have time to clean the room. So in that way, if we the and that person's phone privileges are taken away until their bedroom is clean, which reinforces cleaning their room. to get the phone back. That's a type of negative punishment. So we have in last we have the extinction. Extinction basically, if you will stop rewarding or punishing to a behavior, it eventually disappears. So in this type, it can occur in operant as well as classical conditioning. If let me give you example, like if a parent or any friend of your friends are stopping praising of your work and you eventually stop doing it consistently, so that's an example of extinction. So now we have transference and counter transference. These are really simple concepts, anyone can understand by their own. Like in transference is basically, um, if a patient projects their feeling about someone important, like a parent or any sibling or any friend, onto the therapist. So this is an example of like transference. In counter transference is completely opposite. Like in this one, physician projects feelings about something important onto the patient. Like if patients reminds them of anyone, like any lover, like any sibling, any parent or any friend. So there's a counter transference. Now we have next topic, ego defenses. Ego defenses are high yield. They are usually tested in the USMLE exams, especially USMLE step 1. Sometimes they come in step 2 also. So they don't ask you the exact definitions. They will give you the scenarios, like the examples I will tell you, and they will ask you what type of defense is there. So you have to understand them clearly. So our first is acting out. Acting out basically, you express feeling through actions instead of words. So if you have any stress, any emotional conflict, you use actions rather than reflection or a feeling. So for example, like any patient which is skipping therapy because thinking about his or her past, which was painful. So they cannot reflect that feeling, but they took the action of missing the therapy. So that's an example of acting out. Next is denial. Denial is the easiest one to remember. And this one is simply refusing to accept the reality. So if there is anything, you would tell them most of this occurs at the time of any like bad news. It's very common in the hospital setting. Like for example, if your patient has end stage like any cancer and he or she is diagnosed at that point, and even you are telling them for like chemotherapy options, this thing, and you will tell them like you will feel tired of chemotherapy, these side effects can occur, but the patient is still planning to work full time despite of you are telling them everything. So that's denial, like they are not accepting the reality. Next is displacement. This is important, and this is really confusing with the projection. Usually, whenever this question comes, you will see both option, displacement and the projection in the options, and you will get confused. So it's highly important to understand the difference between the displacement and the projection. So that's why whenever I read these two together. So let's read displacement first. Displacement basically, in displacement, you redirect your feeling to a safer target or to a neutral person. Like you're redirecting your emotions, right? Let me give you an example. In that way, you will understand better. Like, for example, if you are being escorted by the chief resident or any of your attending, right? You cannot talk to your chief resident. You cannot talk to your attending because you are afraid it can like bounce back to you. So whenever you go to home, you yell at your spouse or any sibling, right? Because they are neutral person, less harmful. So this is like you displace your emotions from one person to other person. That is basically displacement. So your feelings are same, but you displace to the new person. So here is the same example, same type of example is given. You can read this one for the better understanding. Now let's study the projection. Basically, the projection is attributing your own feelings to someone else. Like there's something unacceptable internal impulse, and you attribute to the external source, right? This is difference from the displacement. Displacement, you have the same feeling, but you are displacing reflect on someone else. But here, you have your feelings, but you are not accepting that feeling, and you are thinking like that feeling is coming like that's from someone else. Let me give you example for the better understanding. Like for example, there's a man who accuses his wife of cheating because he wants to cheat actually, right? So in this one, he's attributing his own unacceptable thoughts or any feeling to someone else, right? So basically, this impulse is yours, but you deny it and claim it belongs to another. So there's basically a form of externalization to avoid the guilt or any anxiety. Um, so there's basically your feeling, but you are blaming someone else for that feeling, right? I hope you got the difference between the displacement and the projection. Next is dissociation. Dissociation basically is when your mind disconnects to protect you from something very scary or stressful. This is most commonly in question. You will get the hint of any like PTSD, post traumatic stress disorder. For example, let me give you an example. So if there is a victim of sexual abuse, and whenever he or she will see that abuser, she will become numb, and she will like completely disconnect from the world, and she will not remember that event. That's an example of like dissociation, right? So in this one, you may feel like numb, detached, like you're not really there, and you feel like these things are not real, or may you not maybe you do not remember the event. So this is the dissociation. This is most commonly in question. They will give you like post-traumatic event. Maybe they do not use the word directly post-traumatic, but they will give you like if patient, for example, there was an army officer, and there was like he was on the war and this thing happened, and then they will ask you what type of defense mechanism is that, right? Let's go to the next. Fixation. Fixation basically means you are staying stuck at a childish stage of development. This is confusing with a regression. Regression is given here. So I will try to uh, tell you these together so that you understand difference. Because these, whoever they are like confusing, these both are, if they are both are coming in the option, you will get confused also too. So in fixation, you are stuck at your childish behavior, childish level of development. So basically, is partially remaining at more childlike or developmental level, and usually it is persistent, right? Their stress less likely is triggered by the stress, right? Because the other one is also triggered by the stress. So this one is you are stuck at the childish behavior. So means you are arrested in any aspect of development or any personality. For example, there's a college student who continue to suck a thumb when studying. For example, this sucking thumb is like a childish behavior, right? And they continually they do that. So that's basically the fixation. So in comparison of that, this is the regression. In regression, you have involuntary, involuntarily reverting to earlier developmental behavior under stress. So this is basically stress related. So for example, like a previously toilet-trained child begins bedwetting again after a new sibling is born because that child may be thinking like they will love more, they will take care of more than the new sibling. So that's why they have an involuntary reverting to early developmental. They start like bedwetting. So this is basically stress related. It is temporary, and it's also an unconscious defense mechanism. So the key idea for this is the like the person usually go back to an earlier stage because of stress. This regression is also most commonly tested in the USMLE exam. So you have to be careful for this, and you have to remember this. If you will understand this concept, you will nail these in your exams. Next is idealization. Idealization basically when someone focus only on the good things about themselves or others, right? This is like a thing like perfectionist, like this person is perfect, like they focus only on the good things and they ignores the like negative flaws. So for example, a patient who speaks about any physician and only telling you the good things of the physician, like he's best in this, best in this, best in this, but he will not tell you anything negative. This is basically idealization. In exam, they usually give like these examples. They will explain like there's a patient in relation with the um, physician. Patient has been telling everyone about this, and what type of mechanism is this. So you have to be careful. You have to remember these type of examples too. Next is identification. In identification, is it is basically when someone is unconsciously adopting the behavior, traits, or habits of an other person or a group, right? Often someone they admire. For example, if someone is impressed by any resident is impressed by any attending, they like the attending, and the unconsciously they adopt their behavior, right? For example, the a good example is given here. For example, this resident starts putting her stethoscope in her pocket like her favorite attending, instead of wearing it around the neck she used to do like before, right? So this is like identifying. She is trying to be identified like that attending. So let's move to the next, intellectualization. So intellectualization basically when someone focus on facts and logics and avoids emotional side of the stressful situation. Like they depends on the facts and logic and avoid the emotional uh, side of that stressful situation. So, for example, there's a patient like this type of example also usually I saw in like multiple Q banks testing this intellectualization. Like there's a patient diagnosed with a cancer like endocrine disease, sorry, any end stage, for example, primary renal cell, like renal cell carcinoma, and you have been telling them about the treatment regimens different, and but the patient is continuously discussing with you regarding like new treatment options, about pathophysiology and like the useless things, and patient is trying to avoid these reality. So this is an example of intellectualization, like they focus on the facts and logic and they avoid the emotional side of this. Let's move to the isolation. So isolation means you become isolated. It's clear from the name, like separating feelings from ideas and events. Uh, like someone saw the murder and they have been describing it like without any fear, any like shockable face, like they are telling you. So means they are hiding their emotions and they are telling you only the story. So this is like they isolated the feelings from the story. So this is like isolation. Next is passive aggression. Passive aggression basically it is when someone expresses anger or hostility indirectly instead of confronting the problem openly. So, for example, if someone cannot talk to their like boss or someone, but they indirectly started going late and they are absent in the meetings, so there's like the passive aggression. They are not directly showing the aggression, but they are passively showing their aggression, right? Um, yeah, like opposition, indirect opposition. We already discussed the projection. Let's talk about a few words about rationalization. So rationalization basically when someone creates a reasonable sounding explanation, like it's not really reasonable, but reasonable sounding explanation for something that actually happened for a different reason. Usually they do this to avoid the feeling of guilt or blaming themselves. So they usually avoid that thing and they give you some explanation for that event and other reasons they usually avoid self-blame. So, for example, an employee who was recently fired, let me take this example, who was recently fired, and then he said like, yes, that job wasn't that important anyway, so it's fine for me. So instead of admitting any mistake, he's like giving a reasonable sounding explanation. So this is basically the rationalization. Next is reaction formation. Reaction formation is also confusing with sublimation. Sublimation is a mature defense, and these are we are discussing. These are the mature defense mechanism. Let's discuss. We'll do these together. Let me tell you first about the reaction formation. So in reaction formation, basically, when someone acts in a way that is opposite to their true feelings, usually and they hide or deny the true feelings, and they show something else. Like they are feeling something else, they are showing something else. This reaction, like they created some reaction. So let me give you example of this too. Like a stepfather feels some resentment towards his child, but instead of showing it, he treats the child with excessive nurturing and overprotection. So this is usually they are hiding their unacceptable feelings by doing the opposite things. So in sublimation, this is sublimation is basically when someone is turning an acceptable impulse or any feeling into a positive and socially acceptable action. So this is usually voluntary, and the reaction formation was involuntary. So for example, a teenager feels aggressive or frustrated at their parents' high expectation. So, but he channels that energy into excelling in sports instead of acting out. So he's basically shifting his emotions to something positive, right? That's like sublimation. Let's discuss something about the repression. Repression is basically um, when someone unconsciously blocks out painful or unwanted thoughts or feelings from their awareness. So simple words, involuntary, they are withholding any idea of feeling, right? This is opposite to suppression, so they can confuse you with the suppression too. Let me give you example of repression. Like, for example, there's a 20-year-old. He does not remember any counseling classes during his parents' divorce 10 years earlier. So he's trying to repress. He's trying unconsciously, like he's blocking these events. So he's not remembering these events, right? That's basically repression. And suppression is like you intentionally withhold something, right? You are intentionally withholding any idea or any feeling from your conscious awareness. So this is conscious, this is unconscious. So consciously push aside thoughts or feelings temporarily to focus on something else. For example, if there's a tournament going to be very soon, start very soon, and the athlete or any like the tournament players are trying to do some practice, so they are trying to suppress their like emotional responses. Um, in that way, they are doing the practice, right? So repression basically is like unlike suppression, which is conscious, but repression is automatic response and keeping the distressing memory or feeling out of conscious awareness. But in this one, we are consciously we are suppressing uh, our feelings, right? So our next is splitting. Splitting basically you split something, right? You believe that people are either all good or all bad, right? So you are looking the people at extreme levels, like all good or all bad. For example, you are comparing like nurses. Nurses are cold and insensitive, but doctors are warm and friendly, right? You are like categorizing nurses and doctors differently. Like all doctors are good for you, but nurses are not good for you. Like this is splitting. You are dividing it two at extreme levels, right? Like there can be few doctors can be rude too, few nurses can be friendly too, but you are saying no, all doctors are good, all nurses are bad, right? They're not friendly. So this is basically the splitting. So we have two left here. One is altruism, second is humor. These are the mature responses. So in altruism, basically, when someone reduces their own negative feelings by doing some good for others, like you are hiding your bad deeds and showing some good deeds, right? Let me give you an example. Like if there is any mafia which makes large donation to charity, like these are basically mafia, so they have a lot of money from illegal ways, but they are doing some charity to for self satisfaction. So they are trying to hide their bad deeds with the good deeds. So that's basically the altruism, right? They are donating something to the charity. So charity doing is a good thing, and this mafia is a bad thing. So they are hiding their bad things with a good thing. In last, we have like humor. Humor is basically when someone uses jokes or lightheartedness to deal with uncomfortable feelings or stressful situation, right? If there is any like stressful situation and you make joke of that, and you relieve your anxiety. So this is basically the humor. So let me give you an example. For example, any of medical students who went for the step one exam, and it was difficult for him, but instead of like become anxious, they are making joke. Okay, it's fine. Um, Making joke for the exams, and that way they relieve their anxiety. That's basically uh, the humor. So these ego defenses are highly important. They usually you will, if you're going for a step one example, step one exam, you will get few questions like 2 to 3 questions from this chart. It's highly important to remember the concepts of these, and you should know they will give you the scenario, they will describe the behavior, and they will ask you what type of um, defense mechanism is there. Usually they confuse you, which are like similar. For example, your displacement projection, you will get confused in these two things. So in next lecture, I will try to cover rest of things from like I will start from the grief, and this is I think all for today. If you have any questions, anything, if you couldn't understand anything, you can drop a comment. I will try to help you as much I can. And thank you so much for listening.